AM Extra is watching out for you and your health. Seeing mass shootings on the news can certainly be tough, especially for kids.
We want to find out what parents can do to help talk their children through times like these. And joining us live is mental health specialist Eddie Carrillo. Good morning.
Good morning. Thank you guys for having me.
Yeah, thanks for being here. This is really an important topic because younger children are exposed to these violent incidents through media. What should parents do in talking to their younger children about what's happening here?
Yeah, I think I'll do my best to keep it as concise as possible because I do feel like there's multiple pieces to it. One of the important things that the two most important things, I think first one is we want our kids to know that we're there to listen. We want to be able to see where they're at with the news, where they've interpreted any news or media that they've consumed, and see what kind of impact has happened and what they need moving forward. Some kids and teens don't need a whole lot. Some of them need a lot of questions answered. So it really depends where they're at. And I think the second thing, as the adult, as the parents, the caregiver, is we want to see how we're impacted. Something like this, unfortunately, has felt like it's happened consistently over the last number of years, and we might feel almost like fatigue that news like this happens. So we really want to ask ourselves if we're ready to have these conversations. If we're not ready, we want to see what it is that we need in order to be ready. So I think that's really important. Depending on the ages of these kids and teens that we have or that we work with, that'll really show us what we're discussing and what we're talking about with them. Some experts say that around age 8 is appropriate to have these conversations, but it always really depends on the kid. Any ages lower than 8, and maybe if they're not ready, we want to do our best to protect them from any kind of news like that. But around age 8, if a kid is ready to talk about this, we want to focus on like the positives, and that could be really difficult in a situation like this. But we do want to try and be helpful and focus on positive things like how quickly things were helped, how quickly help got to a situation, and we also want to keep information factual for these kids. As we get older, to older children, older teens, it is a good idea to see how they're interpreting the news, see how they're being impacted, see how they're understanding the news. From there, as the adults, we can see where it's best to kind of lead the conversation. In my time working with teens, I think this generation tends to be very solution focused. So, with that in mind, we want to help them come up with ways that they feel safe, they feel empowered, and that they feel like they can be in control of their situation. And I think most importantly, or one of the most important pieces to remind parents and caregivers, is that they might not struggle. They may struggle not knowing what to do. They may feel helpless in the situation. They just might not know what to do. They don't know how to make this better. What I remind parents and caregivers is that one of the most important things that they can do to make the situation better is to continue to provide their kids and teens with a safe and protective home environment.
Yeah, it's difficult. I think sometimes just having that check-in and acknowledging, opening the door to that conversation can be really important. Are there ways that parents can kind of keep an eye out for warning signs, any indicators that your kids might really be internalizing what they're seeing on the news and really be affected by some of these stories?
Yeah, I think if we start to notice any major changes in mood or behavior, like right after an event happens or right after they're exposed to a certain type of news, an important piece with that when it comes to something like trauma is to remember that there is trauma, like trauma that has been acted on us, that we've experienced directly, whether it's something maybe violent or something physical. But there's also perceived trauma, and that's if our kid or teen is feeling impacted, maybe traumatized by something that happened, even if maybe you or I don't necessarily feel impacted. It's important that we acknowledge that. That's a reminder to us that not every we don't perceive things the same way. We're not impacted the same way. As far as like asking for help, trying to find resource for kids, parents and caregivers, they know best. They have a spidey sense. They know when to try to get help, and when they feel like it's time to reach out. There's a ton of ways that they can find help. The typical ones that people think of are pediatrician, primary care provider, other medical professionals. But I think an important reminder is our kids and teens are in school, 8+ hours a day, 190 days a year. They are with their school staff a lot, and they can provide a bunch of useful information on how to help our kids and teens. In a lot of schools, you have school counselors who are trained mental health professionals. You have teachers, you have administration, support staff, really any school staff that interacts with kids and teens on a daily basis. They can help provide insightful information on how to help our kids and teens.
All right. Thank you very much. Great information there. Eddie Carrillo, thank you for joining us on AM Extra.
Of course, thank you for having me.
And for more resources on how you can help your child during moments like these, we've got some links on the AM Extra section of Coin.com. Eddie, one of those mental health professionals in our children's schools, so lots of resources available for kids when they need them.